Hi, my name is Kelsey. I'm a nurse practitioner student at Princess Marian, and today I will be presenting a patient how I would present them to my preceptor. 57-year-old Caucasian female presents to the office with chief complaints of ear congestion. Differential diagnoses include acute otitis media with effusion, and sinusitis. Patient states that she has been experiencing bilateral ear congestion that is worse in her right ear. She stated that the symptoms began 1 week ago and has been progressively getting worse. She states that due to the ear congestion, it's affecting her hearing and that sound is muffled. She stated that she was getting relief whenever she leaned forward and backwards, but as of 2 days ago, nothing has been helping. Along with the ear congestion, she stated that she's also having nasal congestion but denied any nasal discharge. She also denied any ear discharge as well as ear pain. She denied taking anything to help relieve her symptoms. Patient did state that she does have a history of recurrent ear infections as well as a right tympanic membrane perforation. She has a past medical history of a hypothyroidism, environmental allergies, and asthma. She has a past surgical history of a thyroidectomy as well as a vaginal hysterectomy. Patient denied the use of any tobacco use and also denied any illicit drug use as well as alcohol use. She has an allergy to sulfa and states that it gives her hives. I did her review of symptoms and patient denied any fever, weakness, or fatigue. She denied any headaches or sore throat. And she denied any sneezing, coughing, or shortness of breath. She denied any chest pain or palpitations, as well as denied any changes in her bowels. I then did her physical assessment. Patient was pleasant. She appeared comfortable while sitting in her seat, and there was no visible signs of distress. I then looked inside her right ear and noticed that her right tympanic membrane was retracted, although intact. There was bubbles noted behind her right tympanic membrane as well as fluid that appeared yellow in color, and her cone of light was distorted. I then looked inside her left ear and noticed that her tympanic membrane was intact and it was pearly and gray. Her cone of light was 7 and there was no bulging or retraction. There was no fluid or any bubbles noted. Bilateral ears were without erythema. I then assessed her nasal passages, which were pink and moist. Her septum was midline. I did notice some nasal discharge. I then assessed inside her mouth. Her tonsils was 1+ without exudate and without any redness. I looked at her posterior pharynx, which was without redness as well and was without exudate. There was no lesions noted. I then listened to her heart. S1 and S2 was heard. There was no murmurs or no gallops. I then listened to her lungs. There was no adventitious lung sounds bilaterally. Her respirations were even and non-labored. I listened to her bowel sounds. They were heard in all 4 quadrants. I would diagnose her with right otitis media with effusion. I would start her on augmentin 875 milligrams and 125 milligrams for 7 days for a total of 14 pills. I would tell her to take it twice a day. I would also start her on Sudagest 60 milligrams every 6 hours as needed for nasal congestion. I would give her a total of 60 pills with no refills. I then educated her on the use of a neti pot to help with her congestion. I educated her on the importance of staying hydrated and to avoid any smoke. I also told her she can continue to take her allergy medications. I did inform her that if her symptoms do not improve after taking her antibiotics or if they worsen, to notify the provider. I also let her know that even though she might feel better in a couple of days, that it is still best to continue to take her antibiotics until they're all done. I did tell her to let us know if she does start to run a fever. The source that I used to do her treatment plan was UpToDate, and that can be found in my bio. I also stated to the patient that there was no further need for testing.